Hi, I'm Tori, and I am a doctor of physical therapy who specializes in pelvic dysfunction, which means I treat things that can go wrong around the pelvis, and this includes bladder dysfunction. I've gotten a number of requests to talk more about overactive bladder or bladder urgency frequency, so I wanted to create a series dedicated to this topic, sharing what I know about the diagnosis and how to treat it. This video is the first installation in a 5-part series and is going to focus specifically on what causes bladder urgency frequency so that we can make more sense of the upcoming interventions in later installations of the series. As always, timestamps and links to any resources or studies mentioned today can be found in the description below, and without further ado, let's get into it. First and foremost, bladder urgency frequency can be caused by other underlying conditions like diabetes, prostate dysfunction, and even thyroid dysfunction, to name a few. So it is very important to follow up with a physician and rule out an underlying condition being the cause of your urgency frequency. If you've done this and you know that your bladder issues are not stemming from an underlying condition, know that urgency frequency usually is caused by one of or a combination of two things: muscular tension surrounding the pelvis, especially in the pelvic floor, and or bladder habits. What's fascinating about the bladder is that it truly is a trainable organ, and over time you can train your brain-bladder relationship to actually promote urgency frequency, and it can become a vicious cycle that reinforces itself. Because we are here on YouTube and not in the clinic, I am going to focus this series on retraining that brain-bladder relationship. However, I do want to briefly share more about the muscular aspect of this condition in case it's helpful for you. Let's take a quick look at my bladder. Imagine that I am facing you and I have been cut down the center. You can appreciate that my bladder is here, sitting on top of my urethra, which is the tube that connects my bladder to the external world. When I urinate, urine exits my bladder through my urethra and into the toilet. You can also appreciate that my bladder lives on top of my pelvic floor, a very important group of muscles that help support my bladder and maintain my urinary continence, or maintain my control over my bladder and my urine. Just like any other muscle, sometimes the pelvic floor can carry tension or become tight, and that tightness can irritate the bladder living above it, which can cause urgency frequency. What makes a pelvic floor tense up like this? Usually some form of pelvic trauma. Imagine that I was going to punch you in the stomach. Your abdominal muscles would tighten up or tense or contract in order to protect you. In the same way, when someone experiences a pelvic trauma, whether that's maybe passing a kidney stone or undergoing some form of pelvic surgery or childbirth, or unfortunately some form of SA, the pelvic floor will sometimes tighten up, and even though its intentions are so good, even though it is only looking to protect you, it can sometimes forget to let go, and that prolonged pelvic floor tension can cause urgency frequency. If this sounds relevant to you, you may benefit from pairing pelvic floor relaxation exercises and other pelvic floor interventions with bladder retraining interventions. I do have a video dedicated to pelvic floor relaxation that you can check out here. However, you would likely benefit the most from seeking pelvic floor physical therapy, because a pelvic floor physical therapist could tailor interventions specifically to you, your pelvic floor, and your body. If you live in the United States, I will link to a directory in the description below for you. Finally, I do want to mention that while urgency frequency is usually secondary to a pelvic floor that is too tight. It can also occasionally be secondary to prolapse. If you want to learn more about what prolapse is and how to treat it, you can check out this video. All right, now that we've reviewed the muscular aspect of this condition, let's talk more about bladder habits and the brain-bladder relationship. In order to understand how bladder habits can contribute to urgency frequency, you need to understand how the brain and bladder communicate with each other. Let's revisit my bladder and talk more about this connection. So, the bladder is a muscular organ that stretches as it fills with urine over time. And when you feel urgency, when you feel an urge to urinate, you're actually feeling the muscular walls of the bladder contracting, where the strength of those contractions equates to the intensity of the urge. The walls of the bladder are lined with receptors that sense that stretching, and those receptors essentially tell your brain, via bladder contractions, how full your bladder is and when it's time to urinate. I like to simplify this phenomenon and say that a healthy bladder has 3 different levels of urgency. It fills to the first level and you get a level 1 urge, where the receptors say to the brain, hey, you've got some urine in here. It's not a big deal. We just wanted to let you know. And you should be able to respond and say, great, thanks. Maybe I'll take care of that in 45 minutes to an hour. The bladder then fills to the second level, and you get a level 2 urge, where the receptors say to the brain, hey, it's getting a little more urgent. You're not all the way full, but you're pretty full. Maybe we should urinate here soon. And you can say, great, thanks. I'll finish up what I'm doing and maybe I'll urinate in the next 15 minutes or so. And then we have the third and final level, where your bladder is essentially full and you get a level 3 urge, where the receptors say to the brain, hey, your bladder is full. You need to pee now. And you can say, great, I'll stop what I'm doing and walk slowly and calmly to the bathroom and take care of that. So then, why are bladder habits important? How can you accidentally train your brain-bladder relationship to actually promote urgency frequency? Well, when you empty your bladder over and over and over again when it really isn't that full, like maybe you have no urge at all and you're going just in case, or maybe you have a really low level urge, like a level 1 or a small level 2, you can eventually train those receptors to send your brain level 3 urges when your bladder really isn't that full, when they should be sending a level 1 urge. So, bladder retraining strategies focus on desensitizing your receptors. They focus on allowing your bladder to have more stretch before you get strong and really hard to control urges to urinate. And we will start discussing those strategies in detail in the next video in this series. On that note, thank you so much for watching. If you enjoyed the video or found it helpful, please do give it a thumbs up. And if you didn't like it, give it a thumbs down and let me know down below what I can do to improve my content in the future. Please feel free to comment absolutely anything, feedback, content suggestions, questions you have, anything really. I do try really hard to read and respond to all of my comments. Don't forget to check me out on Instagram, and finally, if you want to see more content from me, please do consider subscribing to the channel. I make videos about pelvic things, like today's video, and I also make videos about life things. Thank you again so much for watching. I hope that you have a wonderful rest of your day, and I will see you in the next video. Bye.